Hey, cluster peeps. Here's a little trick, a couple things to know about using sumatriptan to abort a cluster headache that I have found very helpful and saves money. So here's what most of us are rocking these days with sumatriptan. Your average pen here, it's 6 milligrams and 0.5 milliliters. So the thing is you only need 2 milligrams of sumatriptan to abort an attack. And when I say abort, I mean at the beginning of an attack, when you first start feeling it, is when you should do your sumatriptan. Anytime is fine. You wake up in the middle of the night. And if you're in a high level attack, like a 4 or a 5 or above, God forbid, just hit the whole pen. Ignore this. But if you're managing and you want to keep your prescriptions as inexpensive as possible and have it on board all the time so you can do this, I do this. I got this prescribed from my doctor, and it was the same amount that's in here in one of these. And you also get some needles. Now, don't freak out. This is the size needle you want to get with the orange cap. Small, I think it's 10 milliliters. There's a larger size up from that, which is this one, and I find it to be more uncomfortable to use. So you'll get a bunch of those. But you need to get a prescription for this in this size. At least one pass in it. I mean, they may not want to give it to you, or it might be hard to find, but if you can get this vial, it's kind of key. So anyway, you take this. You can use what's in here. Then when it's empty, you can just take this, put it right on top of that, hold it nice and centered over the top. Before you push the button, make sure you have it nice and centered, and you have some gentle pressure on it. Then hit the button. And then once it's full, you just do that. It's sealed. So now you get this inside here. And you can fill one of these up with a lot of pens. So basically, I get 3 aborts out of 1 pen doing this. And if you have to travel, you don't have to bring this and your needle, and you're pretty much ready, set for anything. So here's a little tip on using this. Always swab with alcohol, of course, and keep your needle clean, or use a different one every time. So it's a very tiny needle, if you can see that. It's really small. And I'm not going to show you the full-blown thing, so don't worry. But what I do is I take it like this, because it's a subdermal injection. It's not going into a vein, And those pens, you have to kind of put it right down and push the button. It's painful, depending upon where you do it. I mean, we get used to it, but there's a good little bite there. This is way less painful than that, and sometimes no pain at all. It also, I guess, depends on your skin. So you're only trying to go through like 1 to 2 layers of skin at the most. It's kind of like giving a cat a subdermal, if you've ever done that. The fluid that's in here will go into a little pocket right there, and then it'll just absorb into your body. So you just take this once you've filled it up with one. I go to the 1 milliliter line right here. Like, that's how much I usually would put in there, I think. Not 1 milliliter. Sorry. It's 1/3 of what's in there. So it's like, it's 2 milligrams. 0.5 milliliters is 6 milligrams is 0.5. So it's 1/3 of 0.5 milliliters. So it's a small amount. I don't exactly do it. I just take a small amount. And then you put it, let's see, you put it completely parallel with the surface of your skin, and you slowly kind of you move it like this and gather skin in front of the needle, and it won't go deep because it's not pointing in. And it'll just go right under your skin, not in, don't have it at an angle. You'll see, you can feel it. But anyway, it's pretty painless, and it works great. I find it much better than using a pen, regardless of the savings. Plus, here's the big thing I like, is when I take a full pen, there's side effects. You know the feeling that you get when you have that sumatriptan. It's like You feel like you've spent all your vitamins. I don't know what it is. Your body's like, ugh. You don't get that same effect with when you take such a small amount, but it aborts the headache. Combined with oxygen is how I do it. So that's my tip. Peace.